For best results with testosterone, it's not as simple as taking the injection and just hoping for the best. You need to put your effort in, trying to lose weight, exercising, being weightlifting 3 to 4 times a week, eating better, choosing better lifestyle changes. Stop eating like crap at the fast food all the time, eating protein, healthy fats. Those are things that you can do to ensure that you are getting the best results from the testosterone given. And in the long term, if you're not ready to start testosterone, those are ways for you to naturally increase your testosterone, would be with exercise and eating better. With cash pay and the monthly membership, it's predictable. You know exactly what's going to be charged every single month. All care comes included with it. You get access to me, so we can text, we can make appointments. You have all your medications shipped to your house, and labs are also included within that fee. So there's nothing that's a surprise bill coming in the mail or anything like that. It is the same thing every single month. There are add-ons, and price would always be discussed up front with that, but it is no surprises here. I don't accept insurance because it is just another hurdle for us to have to jump over. It makes things so much easier and more seamless for you, for me, and for the whole experience to not have insurance. I don't have to worry about prescribing anything, because a lot of times testosterone is what you would call off-label. You are only covered by your insurance when you are completely down in the dumps with your levels less than 250. So even if you feel like crap and your levels around 400, 500, but your free T is in the dumps, insurance will not cover that. And so that is something that I don't have to worry about. I can treat the patients that I want to treat and make them feel the best without having to worry about the bills and that sort of thing. That's why I have that monthly membership model that I use. I have to look at the full picture of how your body is going to react when I give you the testosterone, and everybody reacts a little bit differently. So there's no blanket one-stop shop of dosing out there for every single guy. And it's more or less an educated guess when I'm doing that starting dose to see how your body actually reacts with the testosterone. I have an idea of how it should, but that doesn't always do what it's supposed to do. Morning erections, that is the number one thing, probably week 1 through 6, that you're going to notice, like an increase in libido, morning wood again, and then energy. And that sometimes some guys tell me it's after 1 injection. I think that's a little bit of a placebo talking there, but normally by week 4 to 6, I would say you should be noticing an increase in libido and energy, the top 2 things. At the 6-month mark, that's when you should be probably dialed in on your dosing, if not pretty close. That's when more of the body composition changes are going to be happening. So testosterone is going to help your body build more muscle while getting rid of some your visceral fat. So a lot of my guys will notice they can tighten their belts up a little bit more than they were previously doing. When they're working out in the gym, they're going to be seeing a little bit better results. They're going to be seeing more gains, as y'all call it, and just kind of overall feeling better confidence, more energy, and then once again, libido, libido, libido.